Okay, thank you for attending the Performance and Scrutiny Committee people. I'm Councillor William J. Redcliffe, the chairman of the committee this morning, and we're here to look at the Performance Scrutiny people with special reference to children's services, prevention and inclusion, and adult services. Thank you. Thank you. Thank you also for those joining online. I need to read out this wonderful piece of information. This Scrutiny Committee meeting is being conducted on a hybrid basis in accordance with Local Government and Election Wales Act 2021. We will operate alongside the Council Standing Orders. The Council Standing Orders and Code of Conduct will apply at all times during this virtual meeting in the same way as ordinary meetings, and members should conduct themselves accordingly. I remind members that the meeting is being live streamed to the public. Please can those attending virtually switch off your cameras and mute your microphones when you're not speaking to ensure there is no unnecessary background. Can you also remind members that the chat function facility is switched on and to indicate to me when they wish to speak on a particular item. Please don't speak until you're invited to do so, and remember to unmute your microphones and switch your cameras on. A recorded version of this meeting will be uploaded for public viewing as soon as possible after the meeting. We'll have translations of the proceedings and be provided upon request. The images and sound recordings may also be used for training purposes within the council. Thank you very much indeed. So we move to item 1 of the agenda, and that's apologies for absence.
We've got 2 Chair, 1 from Councillor House.
Are there any other apologies? Okay. Declarations of interest. And minutes of the last meeting are before you for your perusal. Okay. We start on page 3. Yes, we do. Page 4. Page 5. 6. And page 7 and 8. Is there any matters arising on these minutes? If there are, please indicate. We will look at them. Right. So we have anybody moving the minutes? Okay. Thank you, Councillor Stewart. Moving a second. Okay, we've gone silent on the online. I shall second them. Thank you, Jan. Jan cleverly second. Okay, thank you very much for that. So we move on to item 4, I believe. Item 4. No, we don't. Yes, excuse me a second. Some of the bits of information. There we go. Item 4 is correct. And the review reports or review, and the reviews or reports actually mean the same thing. We were looking at why we've been using different language because it's confusing me, I guess, and other people. So end of your review, and we start with children's services. Thank you very much indeed. So we have the cabinet members here this morning, and also Sally Ann Jenkins online. Can I invite Sally to? There we go, just like magic. Thank you, Sally, and welcome this morning, and welcome to the cabinet members as well. So, who wishes to take us through the introduction? Sally?
So I'm only here, Natalie unfortunately is on holiday and I'm at a conference in Wrexham, so hence the sort of somewhat confusing attendance in respect to the children's end of year report. I think for us, I'm sure the cabinet member will want to say a few words. I think realistically what we'd be interested in doing is looking at any questions that members may have in respect of the report itself. I think the report does cover the work of children's services accurately and succinctly. I suppose the elements that I would wish to highlight to you in particular, and after discussion with Natalie, are the recruitment and retention of staff, which continues to be a significant challenge across the whole of social services, but clearly puts very significant pressure throughout children's services in terms of social workers, social work assistants, family support workers and residential care staff. And I would also draw your attention to the continued challenges that we have with placements and the difficulties that is, whilst it's posed particular issues during the past 12 months, that's not going to go away, and that's going to be an ongoing set of challenges for children's services. And the third and final point that I'd want to make is really around the pandemic. I think sometimes it's almost, that's old news, that's history, but actually for children, young people, it is still very live in terms of the losses that they've experienced and what's happened to their lives in terms of education, in terms of opportunity, and really different things. So for older children in terms of life experience, and for little children in terms of basic development and where they are when they come into school, so and so on. So those are the 3 points that I would like to highlight, Chair.
Okay, thank you, Sally. Stephen, do you want to?
Yeah, thank you, Chair. Obviously, members are aware it's been a very challenging year in terms of budgets that we've faced. However, through that, the work of the team has been absolutely fantastic. There is other things such as like placements, as Sally was saying then. Because of the change of dynamics, obviously, with the Welsh context, we're going with the Eliminate agenda, which obviously is looking to take the private sector out and trying to eliminate the profits as much as possible. So we're trying to have that look, and we're moving forward on having in-house provision. So a lot of work has been done, and members are aware of North Farm and other provision that's being taken. Some of the reports of some of that work has been undertaken as well. And I think some members may have visited North Farm, which is obviously a good facility, and I hope that they feel the same way. And just amongst that, just the award-winning, of the homes and also the staff and teams has been absolutely fantastic as well. As I said, a good number of challenges with the financial side as well as, as noted there. But I think overall, members hopefully will see it's a very positive year. I'm happy to obviously hear what comments and questions they come up with. Thank you.
Okay, thank you. So we're going to go through the report. Page 17, page 18. Anybody got any questions on 17 and 18? There's only one question that I have looking at the report, and I see that the Eliminate agenda is now compounding the situation with regards to placements and the rest. And this is being highlighted through children's services. And I understand that a regional team is being developed and we're having input into that. But the reality is at the moment, the Eliminate agenda is having a negative effect upon the service. Would you like to expand on that?
So obviously the Eliminate agenda is very much part of the National Programme for Government and a very strong policy driver. And we are working within that agenda. The regional team is now in place, so the regional team have been appointed. We manage that team on behalf of that region, so we are very much embedded in working with that team and driving forward. And the 2 key drivers for that team are really to work with each of the 5 local authorities in the Gwent area with the Welsh Government funding to ensure that we are prepared for the Eliminate agenda. So that's looking at ensuring that we can build both local authority and not-for-profit residential capacity, but also that we can build our fostering capacity. I say that somewhat lightly. It is challenging. It's a very challenging environment in terms of placements. Even prior to Eliminate, placements was a challenging environment for children's services. It has been over many years. I mean, many members on this committee will have heard us talk about this before, about the difficulties in securing appropriate placements for children, particularly the most vulnerable. And my constant plea has been, if any member wishes to be a foster carer, please could you get in touch with us as soon as possible. So I think, Chair, yes, it is challenging. Yes, there are unintended consequences, and what we are having to do as children's services and more widely across other parts of the local authority and other agencies is work in as an effective manner as possible to meet that agenda. We don't have a choice. We must work with what we have to try to drive the change forward. But yes, it is very challenging.
I understand that, and I understand that you have to work within the framework within Wales, and I get that. And I'm glad to see that you are on the regional team. I get that. What I'm looking at is when I read the executive summary end of your report, and when it's flagged up that it's having a compound, it's being compounded. Children's services with complex needs and challenging behaviour is now compounded by the not-for-profit agenda, eliminated agenda. I just want to make sure that our cabinet member and cabinet, then when they continues to look at that. Sorry, but can I take Steve, cabinet member first?
Yes. Thank you, Chair, and thank you, committee. Just with your question there, Chair, it's just to highlight, obviously, as part of the Eliminate agenda, saying about negatives, it's followed up with grant funding as well. So we've still been able to be innovative and one of the only local authorities in the country to apply and successfully, get that amount of grants. So it's just to say that, but also the committee and officers are probably, aware. On UK level, there has been a report on the English level and things like that as well with children's services, saying about the amount of investment that needs to be innovative and to change around, looking at the private providers and the profit making, things like that there. So it's a UK context, but also how they are probably on the Welsh level to see. So it might be this, the thing of keeping an eye out on the Welsh level to see what we're doing, and then obviously how that filters down to the local level then.
Thank you.
It's just a comment, Chair. I support strongly the Eliminate agenda because it's eliminating private profit out of the difficulties that children face. And I think there should not be companies making profit out of children.
Thank you. Thank you. Councillor Cleverly.
Thank you, Chair. My comments, Chair, it's on page 22 and 23. Have we got that far yet?
Not yet.
I'll wait then. Thank you.
No. Okay. Any more on those issues? Lisa. Okay. Page 19.
Yes, Chair.
Yes, Councillor Riley.
Yeah, thank you. Yeah. Yes, I look at the paragraph there. Sorry, I need to go to the minutes, and I find a little bit of contradiction there. You mentioned the pandemic, Sally, but if you look at that paragraph, which actually refer to that on page 19, it says the aftermath of the pandemic on families continue to emerge and has been reflected in both the increasing numbers and complexity of referral to children's services. Despite the increases, the number of children looked after has remained stable, and we have not seen a significant rise in the number of children on the Child Protection Register, which is, of course, is good news. But isn't there a contradiction in what you are saying there? Because on the one hand, we do have increases, but the numbers have remained stable. What are we saying there? Are we saying then that the increased number of children has been dealt with in a different way?
Thank you very much, Councillor Alouami. Chair, if I could just respond to that, is that We've done recently quite a lot of work on the data in terms of the referrals coming in, and then also looking at, of those referrals, how many convert into ongoing work with children and their families. And I agree with you. I can see why that on the surface there's an anomaly, isn't there? Is what we're saying is we're seeing increases, but our registration numbers have stayed static and our total numbers of children who are looked after have stayed static. What I would say is both of those things are points in time, and particularly the children who were looked after figure. That's the figure that on the day that report was written. What that doesn't reflect is the number of children who were looked after for short periods or are in our care for a period prior to perhaps going to live with another family member. So it's not wholly reflective in some ways of what we're doing day in, day out. And similarly with the Child Protection Register, because children go on and off the Child Protection Register as we do work with them. I'm always going to be positive about social services and children's services, and what I would suggest is that I think it is reflective of the quality of work that is being carried out with those families within the complexity that we're seeing, that is leading us to a position where we are maintaining reasonably stable child protection and children who are looked after numbers. But the toll that that takes on staff and the resource that that takes on staff, what I wouldn't want to do is mislead members into thinking that this is an easy position, that those things are being maintained. It is crucial that we maintain reasonably low numbers of children who are looked after, partly because the outcomes for those children are so often so poor, but also because the cost implications that then reverberate for other children within the system. So I think it is a reflection of the quality of the work that is being done with families downstream to work with them earlier, so at the moment that they're referred, and working with the agencies in a positive and constructive way. I do think, and I think what will be interesting is when we're back before you a year from now, is looking at the outcome of this year in terms of the aftermath of both the pandemic and the cost of living crisis, and where that takes us in terms of some of that data and what we see within families. So I do agree with you. I think there is something of an anomaly within that. Yeah. I do think there's a narrative that sits behind it that explains it. Thank you.
Okay. Thank you.
Thank you. Anything else on page 19? Page 19?
It's just off the back of what Si was noting, especially with referrals. As members are aware, during COVID, obviously the schools were basically, homeschooled, essentially. So a lot of those figures obviously had a slight increase as the children were going back to schools, and the referrals were coming there because there's a lot more contact, with the young people. So that does have a reflection as well on the number of referrals that had increased from previous years.
Thank you for that input. Page 20. Page 21.
Yeah, well, welcome report. It's great to see excellent what's been happening in the backdrop of budget constraints. I just want to pick up on the unaccompanied asylum seeker children use a SC, and it's heartbreaking that we're having to fund this, but it's on the flip side of that despite these budget constraints, we're able to get lots in there to support these very, very, very wonderful children and the heartbreaking condition they've gone through, and supporting Newport City sanctuary status. And I think that's really good role, and it's really should be. It's heartbreaking to happen, but it's great that the council take a lead in stark contrast maybe to national policy from local government.
Yes,
on the same page, Chair, of the international team, and I should declare an interest in this matter.
If you declare an interest, you shouldn't really speak, but I'm going to give you leeway, and we'll have a position if we need to.
It's about Newport and the city of sanctuary, and I think that the work that's being done by social services in welcoming families from war-torn countries is exemplary, and it just shows, I think, what the heart the city has, and I congratulate you on the work that's being done very effectively.
Thank you, Flores. Page 21. 22,
Thank you, Chair. Can I come in?
yes, by all means.
Thank you, Chair. Morning, Sally. My question is on page 22 says there's only 40% of staff that is accessing the training at the moment. Is there a problem for them to access this? But I did notice that it's from the 1st of October 22 to October 24. So we have got another year left for them to access this.
Who wishes to answer?
Yeah, I'll pick. Yeah, thank you, Councillor Cleverly. I'm just having a look at it upside down on my screen, so forgive me, I'm tilting just to have a look. Yeah, I think it is about when the point of data was taken. I think you're right. I think you've picked that up correctly. So I don't think it's necessarily a concern. I think it is just a question of timing on that one, as you highlight. So thank you for that.
Okay. Thank you, Sally, for that.
Thank you, Jan. Page 23.
Yes, please, Chair.
Yes.
Thank you, Chair.
Yes, Brown is coming.
Thank you. On page 23, can we have an update on the rapid response team?
Yeah.
That would be good. Thank you very much.
Thank you, Councillor Cleverly. I think probably we would be best in suggesting that we come to you with that update from Natalie and from Rhian Brooke. I mean, Rhian's on the call today, but I think it would be better. We can certainly give that information to members. The rapid response team has been really effective in the work it's done. And I suppose in some ways that goes back to the question that Councillor Alawami posed in terms of that anomaly within the numbers. But between myself, Rhian and Natalie, we'd be really happy to provide you with that update at a future date. We can put that in writing for you. Is that okay?
Wonderful. Excellent. Thank you very much, Sally. Thank you, Chair.
Thank you. I guess on the same, it's the extend the rapid response team with expanded evening and weekend crisis officer. And again, the Welsh Government's limited fund has been allocated to this, and yet the completion date is June, so that's coming on 23, and you're showing 0%.
I think the completion date is just about having the arrangement in place, which is done. So we have successfully got the grant money and we have looked at the expansion, but in terms of actually the increase in the work. So I think we probably need to explore why there's that discrepancy. So forgive me, we'll take that away and look at it, Chair.
Okay, thank you. Okay. And 24, that would be the same. Anything else on page 24? 25. 26. I guess another, if no one else have got any, does anybody else have anything on page 26? Before I mean. Okay. The RAG assessment and completion. Again, we're showing it in green, but the percentages are 15, 5 and 30. Do you want to explain what's going on, I suppose, and give an explanation for this, Sally? On page 26, we're on.
Yeah, I'm somewhat challenged by page numbers. The version I've got's got slightly different page numbers to yours.
Page 11 on yours.
Okay, thank you.
Sorry, yeah, okay. Yeah. So look at page 11. There's a range of things there, a range of actions, a range of outcomes, and yet I do get that we are somewhat away from it, which is 24. But I'd just like to see where we are.
It's objective 2.
I think, yeah, no, I've got it. I think, Chair, all of these things are ongoing pieces of work so that they are incremental. So I think it is all about, we have achieved what we would expect for at this point in time. So although we haven't completed the project in total, we are where we would expect to be, hence why it's green. I think that's what you're questioning.
Yeah.
That makes sense?
Well,
So
it's the answer I agree with. Whether it should be green or not, I don't agree with. Because, because the end outcome hasn't been achieved. Looking at this, it's going green. I understand, it's just slightly confusing. Thank you for that, though, Sally. We'll look at that somewhere else. Thank you. Page 27.
Yes, Chair. On 27, it's good to see that there's a children and young persons accommodation pathway set up. What progress is being made in the development of that?
So they've made some really strong progress in relation to the accommodation pathway and bringing together all the relevant parties to work together. So that's about, because obviously accommodation for young people is not just about children's services, it's about partners in housing, partners in the RSLs, partners in employment. So it's across the spectrum that we need to look at, and the work to bring that group together in a really positive way. I have to say this is one of the most sort of constructive ways forward I've seen in quite a long time in relation to housing with young people and how we can really drive things forward. So that work is very key going forward into 23-24 and 24-25 to how we drive that. I mean, Councillor Druitt, you'll be very aware that there are massive housing challenges across the city and outside. They're turning the lights off, that's interesting. And elsewhere. So there are some issues in terms of how we do that. But I think what this group is able to do is to bring the strengths together to really focus on the needs of our young people and look at how we can develop them. So yes, there is progress. Is it slow? Yes, it is slow and it's going to take time. But I think having that clarity of multi-agency pathway is really important. Thank you.
Thank you. Thank you for your questions. Anything else on page 27? 28? 29? 30? Yeah. Okay, Councillor Cleverly.
Thank you, Chair. On page 30, it's the focus on developing the specialist fostering placements with psychological supports, and it's got the expected completion date is the 30th of April 23, and it's only 50%. Can we have an update on that, please, Sally?
Yeah, and again, I think that's a similar one where what we're seeing is something that's on a longer trajectory of time, and we're looking at how we develop it. So some of the work that we're doing around specialist foster placement is, for example, parent and baby placement. That's one example of where we're looking at specialist. And this also links into the work that we're doing regionally and with Foster Wales. But we can certainly bring that back to you, Councillor Cleverly, in the same way as we can bring back the rapid response for a further update.
Excellent. Thank you, Sally.
Thank you. Thanks very much.
31 and 31, Councillor Druitt. Yes.
The turnaround offer, can I ask, is that offer having the expected impact?
I think the answer to that is yes. I think Caroline also has had some information around the turnaround project, so might be in a better position to answer this than me. Is that okay? Yeah.
Yeah, absolutely. I do know it's a relatively new project. It was only launched probably a matter of 2 months ago while we had a formal launch. I would certainly say it's far too early to be able to say it's definitely had an impact. I'd like to think it will do, but I think it's very premature to be able to pull that data together. I imagine where we are in 6 months' time when we do a mid-year review, So we can hear data behind that. It's far too early to suggest that.
Thank you.
Thanks. Page 32. And page 34. Performance measurements on page 34. The total number of reports of child exploitation during the year. Sally, on performance measurements, you'll probably have it on page 18. Sally's still there.
19.
Yeah, I got it on page 2. Yeah. She's there.
Yeah, I can just tell you the meeting. She's not going to come on, yeah.
Oh, there we are.
No, I'm here. Thank you.
I thought the lights had gone. Oh, really good. That's the lights. There we are. Thank you, Sammy. The total number of reports of children exploitation received during the year. There seems to be a steady increase. One could say between there was a significant jump last year, 21 to 22, and there seems to be an increase of 22 to 23. What I'm trying to do is I'm unable to break down into the figures as to why it's increasing. Is it because detection is high, or what lies behind this figure, and is it an upward projection?
Okay, so I mean, you're absolutely right. There are a number of reasons why we may see an increase in that. The first may be that we're better at working with and detecting. But sadly, the other reason that may well be is that there is an increase in exploitation, and actually separating out those two things is quite complex. And it's also recognising that children's services and social services more generally is very much a reactive service. So it is a really difficult area for us in relation to exploitation in preventing it happening, because actually this is a societal issue. This is something that is much bigger than social services. This is about how we treat each other, how we treat our most vulnerable, and how we care for them. So whilst the figures that we see are indicative of what's being referred to us and what we're working with, the questions about why we see increasing rates of exploitation, I think, are much more complex. I mean, we have historically come to this committee and had some quite lengthy discussions around exploitation, and we'd certainly be prepared to do that again with yourselves to really explore some of the issues in this, which may well be a useful discussion, I think, for members to understand, because there is a complexity around exploitation that the figures, I think it's often, you do need that narrative and that understanding behind it. And if you'd like to have a discussion about that in the Forward Work programme, we'd be really welcome to have that and do that exploration with you.
We'll take that. Do you still work collaboratively with Gwent Police?
Yes, absolutely, we do, with all partner agencies in relation to exploitation. So children's services, adult services, youth justice, Gwent Police, colleagues in health, colleagues in the third sector. I mean, all our work is around working together, but exploitation is absolutely fundamental to work with our partners in criminal justice.
We welcome a further debate on this, and we will arrange that. Thank you for that. Anyone else on page 33? 34? 35?
On 35, can I ask the performance measuring tolerance? It's 15%. Why is 15% being agreed? Why is it the figure? That's what I'm saying. Asking.
Okay. Here we are.
Apologies, Councillor Druitt, I'm having some, not only have they turned the lights out, they're now hoovering as well, so I'm having some difficulties hearing, so apologies. So in terms of performance measures, we are currently doing a piece of work to look at exactly that, to look at the tolerance around the performance measures and how we do that. And we've had some early discussions, because we're not at the moment wholly comfortable with quite how we do it. So we are currently doing a piece of work around that. So by the time we come to you with the mid-year reviews and then next year, I think we would be in a better place to have this discussion. I think about how we look about, again, when you look at the sort of data in children and adult services, what's good and what's bad. Is a low number or a high number good when it comes to children who are looked after or adults who receive a care and support package? And I think trying to find ways that we can better reflect that is a piece of work that we're already looking at across children and adult services, and indeed prevention and inclusion. Thank you.
Thank you. Thank you, Sally. Page 36. I think that's complete. That completes the report of the end of year review from the board for children's services. Thank you, Sally. You can.
Thank you very much, Chair.
Difficulties there. Wherever you are, I know where you are. I just didn't realise it was on a different time scale.
I shall leave you in the capable hands of Mary and Caroline now. Thank you very much, Chair. And thank you
very much indeed.
Thank you.
Good morning.
Okay, thank you. And now we turn to adult services. Good morning. Welcome, Mary.
I'm Mary Ryan, Adult Services. I realise you will have read the report, but actually, I think 22 to 23, we were still in that period of recovery from COVID. Huge challenges in adult services in terms of our internal workforce and also our external workforce that we commission in terms of domiciliary care and residential care. So there's been some major challenges, and in 22-23 we did see a rise in the amount of residential placements for our Newport residents. That's because we couldn't get domiciliary care to support in home. We're at the point now where there's been a big swing in that and a big investment in our domiciliary care agencies. So that picture has changed now, where we are in sort of middle of 23. But at the end of March 23, we were still in a very precarious position. Lots of our smaller domiciliary care providers couldn't attract a workforce, couldn't retain a workforce. So our commissioning team did a lot of work in terms of working with small agencies for them to be amalgamated, because what we didn't want is the care for people to be interrupted. So if a small agency were closing up, saying they couldn't no longer provide what we needed, but we would take their care staff and put them into another organisation or sort of be part of that to try and make sure care wasn't interrupted. Touch wood, at the moment, the whole workforce remains vulnerable in terms of our domiciliary and residential providers, but it's much better than what it was this time last year. So that's a significant improvement. The other major work that we started in 22-23 was really about the redesign of adult services, where we had lots of sort of small teams, but actually we had no resilience. And in terms of our statutory function, we need to make sure that we're actually providing and delivering on all our statutory functions. So the redesign has really been about making sure we've got a very smooth pathway into adult services. So instead of having 5 or 6 doors to enter in, actually in terms of looking at our offer, information, advice and assistance, which falls out of the app that we work to, that's what we've been working on. So by the end of the year, we had things in place in terms of we knew what the structure is. What we didn't have was the management of the workforce. Touch wood. At the moment, I can say that that's much more positive this year. We've just recruited and we're in consultation at the moment now with adult services. But into March last year, it was difficult in terms of preventing people going into hospital. So there was a big health pressure all the time to always focus on getting people discharged from hospital. And we have a big piece of work that we do there on a daily basis. We manage the Home First service, which is a regional service across all the hospitals, and Newport lead on that. And that's really about sort of turning people around at the front door of a hospital if they don't need to be there. So there's a big piece of work that's still going on with health, because there are many pathways to come out of hospital, in terms of we have step up, step down beds, in terms of if people are medically well, they can't go home for whatever reason, because they need a stair lift, because they need a small care package, so they can go to Parkins or even Spring Gardens if there's some dementia, in terms of they can go there for up to 6 weeks, where we rehabilitate them for them to go home. So there are many things like that that are ongoing. But what we constantly say to health is, 8% of our population go through the hospital. The other 92%, we're doing everything we can to keep them in the community. We know they're safer and healthier in the community. But it's about providing that domiciliary care to support them. And so we're at the stage now where it's tilting back. So instead of going into residential care earlier than what we would want, actually we're able to support people at home. That's the basis. I mean, I don't know whether you want to go through the report in terms of, but that's sort of the background of what services, and in terms of looking at how we design this and how we do it. So we've got a full front door in the hospital and the community that mirrors one another. And we've also got our managed care teams up and running now. So anybody who's got an eligible carer support requirement that needs assessment goes straight into managed care, and they stay there. So they're not bouncing around and going into hospital, being closed down and coming back. So it's a smooth pathway for our citizens and for their families, so they know, and professionals, so they know what to do. So that's where we are at the moment.
Thank you. Looking in the cabinet member, if you want to add to that, Councillor Pugh.
Yeah, I think it's important to recognise what's going on really in social care, because we've come through COVID and it's been very difficult for our staff to sustain that period of support, and we've gone into a very difficult period for lots of colleagues across the health sector, across the social care sector, and we've got a lot of things going on. So we've got situations where that's placing pressure on housing, it's placing pressure on hospitals, it's placing pressure on people living in the community, where their economic circumstances are changing, becoming more difficult, and that in turn leads to mental health issues, leads to anxiety issues. So we've got a lot of things going on in social care, and what that leads to is similar pressures to what we've got in the children's services. It leads to pressures on the workforce, because there's only so much people can take at the end of the day. We're into the sort of second, third year now of a very difficult period in social care, at a time when other things are challenging as well. So they're having to be very reactive to lots of change in society. There's no getting away from the impact of the economic crisis on people's lives. We're all living it every day. You're seeing it as members, you're seeing how that's impacting on society, and there are repercussions to that on health and on the well-being of our residents. So you're seeing that sort of wave come through society really, and I think what I would say about our staff is that during that period they've remained innovative, they've remained resilient, and they're still continue to transform services to make them more sustainable in reacting to the changes that we're going through. So I pay a lot of credit to a workforce that the challenge is actually trying to improve services, trying to transform services. So what we're seeing there is still really strong work going on in relation to the work going on with our carers. Still going for accreditation in relation to World Health Organization, how we care for older people. There's still really strong aspects of work going on. So that's not taking away the fact that they're working in a climate that is an incredibly difficult environment for social care staff. And that has an impact on whether people want to come into social work or social care. And that has a sort of a knock-on effect all the way down the board. So what you see really is staff that are under incredibly difficult, challenging period of time for social care, trying to react to lots and lots of external circumstances that are impacting the work that they do. So it's a very challenging time, and I pay credit to our staff really holding on and actually working through this period, and hopefully things will get better across the board.
Thank you for all that. Okay, I'm going to jump straight into the report on page 39. Any comments on that page? Page 40.
Yes, mate. Well, yeah, just up from what the cabinet member said there, so a backdrop of the excellent work that's been done. And just, there's lots of great case stories, but the Pwyllgor Council last week, the tremendous story of the Chatty Cafe that Simon Schumacher and the team are doing there.
Fantastic.
Is that step, build on the backdrop of, you know, the start we had it amazing, it's perfectly, and that being recognised nationally, I think really is outstanding.
And in
Yeah, please,
And in 22-23, the community connectors and the carers, that sort of like relaunching that again because people started feeling a little bit more confident to go out. So we sort of relaunched the Chatty Cafe last year. But now from April this year, that community connectors and carers will sit in preventions because that's exactly where they should be. But a huge time with adult services, you know, on a daily basis, really. But yeah, absolutely, yeah.
Don't worry, Mary, I don't want to stifle your enthusiasm in any shape or form. You feel free as you wish. Page 41. Page 42. Okay. Page 43. And 44.
On 44, Chair.
Nice.
I've got progress is being made on the enablement service for people with dementia.
So there are a couple of things happening as well. Mentioned sort of the step down beds. Recently we've got 3 beds in our own home, Spring Garden. That's purely for people with dementia that may be in hospital, the community, and the circumstances change and they need some rehab. So that's what's happening with those 2 beds. We are looking at whether we need to expand that in the future or not. So that's what's happening. There's also the enhanced dementia project, and that's the third sector health funding from the RPB within the centre of Newport, and that's been built on a project for a dementia hub in Swansea that's been very, very really informative in terms of the numbers. So in terms of, I mean, the biggest debate we've had is whether we call it a dementia hub. And it's like, you know, will it be a Welsh name or will we do something different? Who will know what it is? And actually, what was very clear from a service use perspective, they say, no, we know we were. So people who've got early diagnosis or are concerned, they'll be able to go there and get some information about what it is, what are the next steps, what else do I need to be doing, and in terms of like community connectors and all those sorts of things, we're making sure that's all going to be part of that offer.
Thank you, Mary. I wonder if you can expand on this for me, and it's the learning disability accommodation.
Yeah.
And it's a wonderful piece of work, a great piece of work involving and continuing to recognise the needs of this part of the society. We speak highly about the commissioning team and the social workers and everybody else. Can you reassure me? Can you tell us? Are the client base involved in this progress at the same time?
And I think from a learning disability perspective, so we have transitions. So children with learning disabilities will be open to disabled children's team. They come through to us, obviously at the age of 18. It's quite interesting. We were looking at these figures only the other day, and probably we used to have sort of 3 to 5 young people coming through to us at the age of 18. Now this year we've got 25, and also in terms of people with a learning disability, fantastically their life chances and their life experiences are so much better than they were. You know, most people, there were some big stats about sort of between 40 and 60. We support many people with learning disabilities in their 70s and in their 80s, and obviously their needs change. So that's about us making sure we've got a good plethora of services available. Within the majority of young people with learning disabilities in Newport, we do know about. We know about them as children. We know about them as youngsters and then transitioning. But actually, them being part of where their next steps are, it's more than just talking with them. It's their families, isn't it? It's part of families to set it low, and it's part of family who we want to support. So it's about working flexibly with both the individual and their families in terms of what could be what could be the best for them in the future. So some of that is a set programme, some of that we've worked with Pobl, we've worked with other residential supported living environments. So we've got the front door, we've got different projects in Newport which work fantastically well. And in terms of people that are living independently, but there is support there available. I think Councillor Hughes and Mawrth would have been to see them as well. And we need to build on that so there's more flexibility in terms of what people need.
Thank you, and it's handy to see that you involve the family as well. For family, very important. Thank you. I wanted people listening at home as well as around this table to hear that part of the good news. Page 45. And 46. And then 47. And 48. 49. Page 50.
Thank you. Yeah, in relation to the innovation technology and the assistive technology and the new smart house Newport market.
Yeah.
I just wondered, it's great it's happening, but what exactly is it? What technology are we talking about, and how? I suggest it's little things that make a big impact on the user.
Well, the opportunity is there if you would like to go and see, see it and visit and see what is potentially available. But actually it's about us trying to assist people with technology to stay at home or to stay living independently. So there are a variety of things. There's something called a comp, and actually we've done this before, but we could do this again for the council in terms of we can do a display in terms of what is there and what possibilities, and for your own families as well. So a comp would be like a computer that's on the, it's like a television screen that's on the whatever on the wall, and so it means families can ring in and out. So if mum's at home, and you can ring in and say, "Mum, we take your medication," and you can see mum and she can see you. In terms of sort of prompts and things like that. I think it's one of the stories has been about one man who went to visit his mum something like 15 times in a day because she kept ringing in, whereas put comp in, and he was trying to work as well, so it was very difficult. And you don't want to not go because you just don't know. Put the comp in, it's great. She rings in, he phones from the comp, he can see her, she's fine, she needs some reassurance, and everything's okay. So that's made a dramatic impact on his life, but also for mum, that she can see her. We've got family set up. We've got one family in Australia who are in regular contact with their parent, as well as other places in the UK and up in North Wales. So that's one thing. We have things that can open and close your blinds. So people, instead of people falling or people that open their curtains or their blinds, that can all be done automatically. Same door entry systems. We've got some animated cats and dogs and babies and stuff, which probably seems a little bit odd, but if you have a dementia, instead of us using medication to calm people down when they get upset or distressed, actually what we found is somebody's had a preference for a dog or a cat, and they are they're a bit spooky, I have to say, but they do seem to give a lot of comfort in terms of, de-stressing. We've got these in our residential homes as well as private homes. So there's a whole variety of, and much more than that, that's available that we can do a sort of setup session, and for all councils that would be welcome, either in the market or we can have it here. It's a sort of an interactive, and it may help in terms of communities you serve, in terms of have you thought of X, Y, and Z?
Yes, would be the answer to that, by the way.
Okay,
and before I bring in the cabinet member, if I take the other questions, maybe it might help. And then we got a third question. Councillor Cleverly.
Thank you, Chair. Yes, my question is on page bear with me, 51 on the
Can we
safeguarding
deal
training.
with the current question at the moment? So
Oh,
you've all that
sorry, I
forward
thought we
at
were
the
on
moment.
page 51. Apologies.
Councillor Alioni, are we speaking to the current one, which is the innovation smart? Yeah. Are we speaking to that point?
No, Chair.
Okay, can I stop you there for a second and then we'll
Yeah.
move on then? Thank you,
Yeah,
Councillor Alioni. Okay, so with on the same, Councillor Alioni will come back now. On the compound innovation and the technology, the smart one. So if you're dealing with constituents or with people who have an agoraphobia, a fear, they can't leave the house, they have panic attacks, but actually could do with this assistance, do we have an outreach? Do they come? You know?
Yeah, I mean, I think at the moment we're trying to expand. It's only been available enough the last 3-4 months. So what we want to do is be able to expand that, and actually going forward, potentially, if there's going to be a dementia hub, that'd be a perfect place for it. So you can sort of amalgamate that, and that will be open for everybody. Yeah. So if somebody's got an eligible care and support need or needs advice on that, they just have to remember.
But there's some people that can actually, because of they can't leave their homes. So you see what I'm saying?
Yeah.
So they have a realistic problem that's quite a high percentage of people that are housebound because of various reasons, and they can't come in. Yes.
And I suppose from that, and in terms of we work very closely with our mental health teams, our 65 and over 65 mental health teams, and they also use some of this technology in a different way that we may not have thought of, because exactly for that reason you just said.
Before we move on, and bring Councillor Geordie on the same point. No? Yes. Yes.
Oh, yes, absolutely. Yeah. Sorry, so sorry. So
Children lots.
Yeah, sorry.
Oh, yeah.
I'm sorry.
I do apologise.
Yes. I think it's to reinforce, because, you know, I've been down to the hub down there, and even though I've worked in this field for decades now, I think technology is changing so quickly. I think I'd recommend anybody goes down if they get a chance, because I think even if they're not sure if that thing exists, there's a good chance it will. And I think, you know, it's everything you can almost imagine becoming reality now. And it's not some sort of Terminator sort of scenario. No, this is about genuinely assisting people who would have been in difficult circumstances 10, 15 years ago to live more independently. And I think, you know, I've got a situation with my own family where my father's in his 80s now. If I couldn't get in touch with him daily and see what he's looking like on screens and all this now, it would be much more difficult to live hundreds of miles away. And then, like Mary said, we've got people living in Australia who are able to do the same thing. And I think across the board, from whether it's adaptive, if you're looking at things like wheelchairs, if you're looking at things even right through to toasters, right through to open burns, you know, if you think about it, it's probably there. We just don't know about it yet. So what I would recommend is that you do try and go out there. And the whole point of these things is to help people live a better life and to help people live more independently. And I think, you know, as we progress now into AI technology properly, I think you're going to see some revolutions coming that will transform the way we look at some conditions, even diagnostics within hospitals. So I think it's quite an exciting time. But also a time I think that's going to transform people's lives, and I think that's the positive.
I'll bring you back in now. Yeah, I will let them go.
Thank you. It's just to add on to what Councillor Hughes was noting. I think it's, you know, it'd be a massive impact to the individuals obviously affected in one way, shape or form, but also to the carers, especially young carers and obviously adult carers. The fact that they can go into work and things like that, they look at part-time and actually, you know, not feel guilty of having to do things for themselves and have their own lives as well. And I know sometimes there's that there, but the actual feeling that they have the technology, the fact of, you know, Wi-Fi kettles and stuff like that there now and all different things, can make such a difference. The fact of having to go into the morning, for example, open the curtains, there's certain tasks and stuff like that now, which enables people to you know, have a little bit of their own life, but also care for their family as well at the same time, which makes a big difference for the family perspective. But it hopefully helps the avoidance of burnout with the family as well.
Yes.
Yeah, and I just sort of wanted to add to that. During the pandemic, there were so many families living at home with their loved ones and there all the time, because they were all furloughed and I've been there. So there was quite a bit of work that had to be done for people to go back into work. So they think, well, mum, be okay, I've been here 24/7. So it's been a sort of it's a two-way benefit for the individual as well as for the family member. But also, what will this impact on is our council budgets going forward, because if it delays somebody coming into formal care or requiring additional care, they may be able to go from 4 calls a day, maybe down to 2 calls a day, because actually there's a family checking in with them. Then actually, you know, we've just got to continue with this journey. Yeah.
Totally agree with everything that's been explained. It's all about keeping people independent, and technology and independence will go hand in hand. And it's an exciting time. It really is an exciting part of the business that you're in. Okay, yes.
On 50.
On 50, yes.
Then I ask a different point. It's about carer-friendly employer accreditation. Can you expand on that?
Yeah. So this is sort of moved over now. So we have some guidelines, but we started the process in terms of becoming an employer friendly for carers. So in terms of about making sure what is our offer to staff who are carers, so that's going on. So we've achieved that, but actually now it's about an employer, and it's bigger. It's the World Health Organization, which is what we're applying for at the moment. And we've actually applied for some money from Welsh Government. We got that money, so there's somebody in post working very proactively across the council.
Okay, page 51. I think that's you, Jan. That's a Beverly.
Yes, thank you, Chair. Right, my question is on the safeguarding training. I'm a bit concerned about when staff are first employed, before they start working with, especially in the homes like Parkways, Spring Gardens and Blannypan, because we've got very vulnerable old people in these homes.
Yeah.
Do they have the safeguarding training and their DBSs before they actually start working with the people in the homes?
Yeah, absolutely. And I think the 30%, if you work in adult services, there's a whole onboarding process, whether you're working in one of our homes, or whether you're working as a social worker assistant in the community. There is a huge onboarding process, and that is all about making sure everything updates. I think this is really just an error in terms of how that's recorded. So in terms of adult services, you know, there is a very, very strict, and you know, you can't even go out to meet with the family, whatever, until everything has been completed. So I think this is inaccurate, but I think it's the way centrally the information is taken. So in terms of the safeguarding for all training that's available on online for everybody, well, whether you're a social carer or a social worker, you will have done an awful lot more of that just to get where you are. So I do think you're absolutely right to raise it, Councillor Cleverly, but actually that's inaccurate.
Okay, thank you for that. Thank you, Chair.
I'm just on the same point. If it's inaccurate and it's got an end completion date of 2024, how inaccurate are we?
You know, that's about looking at how the data is collated. So it is about everybody's completed that, but actually it's not coming through on the system in terms of, but that should be 100%.
Okay, we look at that.
Yeah, absolutely.
Right.
Yeah.
Okay, who's this? Right, thank you. Councillor Al-Yawami, is it on page 51? Councillor Al-Yawami?
Ah, sorry. Sorry, I was on mute, yeah. No, it wasn't. It's actually on a couple of pages back. I think you went through it rather quickly, but said really, you know, we just get on with it now. So I'm trying to get my hand down, but I don't know how to do that. It doesn't seem to go.
Oh, that's okay.
Okay.
Okay,
you.
okay, and I'll go a bit slower. That might help. But jumping anytime you like. Page 51. (52), 53, 50.
Sorry, Councillor, can I make a point regarding number 5 on page 53? And that's just really to update it looks like appropriate. Thank you.
Yeah, okay.
And that's so we have continued. So the deprivation of liberty safeguards, which was being introduced, and that's what we've been working towards the last couple of years. It was going to change to liberty protection safeguards, and that was to do with the cumbersome processes involved in deprivation of liberty safeguards. That has now been put on the back shelf at the moment by Westminster and also by Welsh Government in terms of other priorities, and also some challenges to the codes of practice that they were looking at. So we will be changed. This has changed now for this year going forward. We still have a big commitment in terms of making sure anybody who's has a deprivation of liberty and is not allowed to leave wherever for safety reasons and has gone through a whole process, that's all still in place. But I mean, it might be worth us actually delivering something on the deprivation of liberty safeguards for the council, if you would like that coming forward, so that you're updated on that.
Well, I think to have it clarified,
Yeah.
that DOLS is still in place, and that's the system that we're using. Because we were waiting and it was put back, due to COVID at the time.
Yeah, 2020.
Yeah, and now it's been put on a night shelf.
Yeah.
You won't see it now for a while, that's for sure.
So if that would be helpful for the council, because we were sort of working on a slightly different, we were preparing for something different.
And I always think it's good for members to understand the deprivation of liberty, so that when they see this, how important it is. And there we go. Yes, thank you, Mayor. 54, 55, and 56, 57. And 58. Thank you very much indeed. That completes the end of your review for adult services. Thank you very much. Now, without any further ado, we move to prevention and inclusion. Is everybody else okay to continue, or would you like a break? Or no, we're fine. We're moving on. Okay, thank you. We have Councillor Harvey, the cabinet member, and Caroline. I don't remember the surname, so it's sorry.
Right.
It is indeed. It's actually here, but you know. Thank you so much. Okay, who's going to introduce this? Do you want to do it first, and then the cabinet member?
Yeah.
The cabinet member will introduce it. Thank you.
Thank you, Chair. This is the first end of year service plan report for the new prevention and inclusion service area that sits within the Social Services Directorate. Prevention is a core component of key legislation impacting social services, and the new service area is aligned with the Social Services and Wellbeing Wales Act 2014, the Wellbeing of the Future Generations Act 2015, and the service plan demonstrates Newport's delivery of these legislative requirements. We want to safeguard our vulnerable cities in Newport and support them to live healthy and fulfilling lives. This means we have worked robustly and collaboratively with a range of stakeholders to bring a holistic, coordinated response for local needs. Newport Council cannot tackle many of the issues affecting citizens alone. Partners in the third sector, health and police, for example, all play a role in helping to make communities safe and healthy. Tackling inequality in Newport and responding to the cost of living crisis are just two areas where multi-agency responses over the past year has seen support, information and assistance be delivered directly to citizens. We want to support families and individuals to aspire to be the very best version of themselves. We know evidence tells us that early intervention is key to achieving this, and that's why we have so much investment in the early years and expansion of Flying Start, which is a testament to it. The Welsh Government programme has seen a further 4 key areas at Newport identified in the last year alone to be Flying Start participants. We want to ensure citizens can be supported to live independent lives and have identified needs met appropriately timely to avoid any escalation of those needs. Intervening earlier and preventing the need for higher, more costly tiers of support remains at the heart of prevention and inclusion. There has been a greater focus over the last 12 months on ensuring services are accessible and inclusive to everyone. As a result of the realignment of teams into the new service area, we've been able to undertake comprehensive reviews of the services to identify what improvements could be put in place and develop and strengthen areas of the practice. This work has included improving pathways, reducing duplication of interventions to families and individuals, and in addition to producing improved outcomes for those families and individuals. This approach remains in place and we will continue to do so. The last year has seen prevention and inclusion make a positive start in cementing its core vision and direction as a service area. There's a lot still to do, including new marketing strategy that details the clear early interventions and preventative offer within Newport City Council. These areas of work are all in progress and we expect year 2 to see further strides being made in ensuring the offer is fit for purpose and demonstrating a positive impact for our citizens. And if I could just add, I am extremely grateful and lucky that I have the staff that I do, because nothing is too much. They're forever going that one step further constantly.
Thank you for that, Caroline. Do you want to add a few words?
So I do. Thank you, Chair.
Thanks.
Thank you for your kind of work there, Catherine. It's really just to kind of pick up this point from the introduction of the report. Obviously, we have the report, and we've had a chance to read it and enjoy it. Just a few kind of headlines I'd like to pull out really is, as Councillor Harvey has just referred to, this is our first end of year report. So we mustn't lose sight of the work that's required to put a whole new service area into place, which is very much what's been going on for the last 12 months. There's been a lot of movement with teams, a lot of HR, and a lot of staff consultations that have been underway and have gone extremely successfully and smoothly. All of that has happened while staff have continued to deliver all of their services and keep buttons and engagement out there in the community. So I have to commend the staff and all the workforce involved whilst all of these structural changes were happening. So for us, really, the focus of the first year has been establishing the service area, looking for areas of growth and development, and looking at how we can look to improve what we're doing, what are the gaps, what difference are we all making, and then start to think about where do we want to go to and how we want to move forward. Recruitment and retention has come up previously with Sally and part of Mary's world. We also have had similar challenges, although we're not predominantly a qualified social workforce. We do work predominantly with qualified youth workers, play workers, and particularly we try and start with health workers, midwives and health visitors. And all of those areas have experienced recruitment and retention challenges. So it's a national issue that is being addressed externally but also internally in terms of how we can develop our own workforce and train the unqualified staff up so that we're actually building a workforce for the future. So we have had those challenges as well, and that particular challenge has led to some not huge delay, but it has slowed our progress down a little in terms of where we wanted to be. But that said, we have made enormous progress in the first 12 months. It would be remiss of me not to highlight, particularly from our role, the pressures that we feel under in terms of prevention and inclusion and what we're seeing coming through. We've got to take into account the legacy of COVID and lockdown and the pandemic issues, the cost of living crisis that we're currently living through, and how that also links and overlaps with poverty and poverty affecting our local citizens. So they are very much drivers in our world. So what we're seeing is a mix of increasing referrals coming through, higher complexity, lots more mental health issues coming through and anxiety in children and parents. So we're seeing definite trends as a result of some of the kind of themes that we've been working through and are currently working through. And those drivers help to shape what it is that we're delivering out in the community. So we're very much listening and learning from what is out there, what is impacting on our local residents, and therefore what do we need to be providing in response to that. And just two more points to raise, really, just to highlight the risk that is highlighted in the report. The only risk to us was predominantly our service areas about growth and development and opportunity. The risk to us is being predominantly a grant-funded service area. So if we look at the difference in terms of how the service area is funded, you know, we have something like £27 million in grants versus a very small amount in core council budget. And that's not a criticism of Newport Council, it's very much about the amount of grants that are out there provided by Welsh Government to support these programmes and make sure we're delivering the support early and in a preventative model. But the nature of grants is that it's not in our control, so to speak. That said, all these grants are national grants, they're not just Newport grants, so it will be remiss of Welsh Government to make any quick changes to any of these grants. And certainly there is nothing on the table or on the horizon at this stage to suggest that is that we're at huge risk, but it's a risk nonetheless, but at the moment I would class it as a low level risk. And then finally, let's make the final point. The key bit for prevention and inclusion within social services is to make sure that we are linking in with adult services and children's services, looking at how we can support the absolute pressures at the front door, particularly in statutory services. So if we're doing our job properly, we should be making an impact on those. And now that's so black and white, and you said, you know, the reality is much more challenging. But, you know, it's very much about looking at how we can develop pathways, work in a different way and link in with our resources together to make a difference to people earlier and stop those more high intensive costly care inputs of intervention. So thank you, Jack.
Thank you. Before I bring Councillor Al-Nuami in, thank you. Great introduction. Great introduction. And the only thing that I would ask you to refrain from, and I hope you take this in the right way as your critical friend, is all your staff are professional. You have no business unqualified because they all go through professional training. And I think it's a miss to call them unqualified because they are all professional and qualified in different ways.
Absolutely.
And social workers are the same, you know. I'll throw that in then again for the cabinet member. So thank you. But besides that, thank you very much indeed. Okay, councillor Amy.
Yeah. Yes, I think it is page 61, Chair. Have we got to it? Is it in the introduction?
Okay, yeah, it's because, yes, we're there now.
Yeah. Can I ask what are the differences between objective 1 and objective 2 there?
Thank you, councillor. A valid question, and I think, you know, one that is helpful to clarify. The objective 1 is very much about working with individuals and families in their own communities. You know, there's a real drive in our world around making sure that what we're doing is place-based and community-based. So what we want to do is develop services in communities or support people in their own homes so that they remain able to live in their own communities and homes. That people do not need to leave, for example, because they may have poor housing. You know, it's about what can we do to support people to remain in their local community, which by and large is what people want to do. So that's the first thing. That's about staying in their own communities. The second one is about meeting their needs, which is a range of, it could be a range of anything really in terms of what their identified needs are. But the key difference between 1 and 2 is objective 1 is about making sure that we provide support in the community, not say in the city centre or in hospital. You know, they need to be in spaces where we can access people can access fairly and equally.
Yeah, I mean, I look at them and I think the two can be easily merged because they seem to address the same issue. They are both about early intervention. They are both about delivering, you know, services for children, young people and their families. And I think the, you know, their final objective is also the same. So I have to say, I couldn't see a great deal of difference between the two of them at all. Is it an issue of timing? I thought about that, but then they both do go for early intervention, so the timing is the same, isn't it? And, you know, the same sort of client groups we are addressing and everything. I do think they are very, very similar, actually. And they could be actually combined together.
Well, we can discuss that at the end of the meeting and we can put a recommendation up if committee feels that's the correct way to go forward. Thank you, councillor.
Yeah, I take your point, Chair, if you don't mind me saying.
No.
It's just that, you know, I wanted to obtain the officer's view of this. It is their report, isn't it? Okay.
It is their report, but these are the objectives that they work towards rather than write themselves. But we can always help them going forward. Thank you. Okay, page 62 and 63. And then we move into the body of the report, page 64 and 65, 66.
I was pretty quick at I my hand went up.
Yeah, that's okay, no problem. I've noticed that. Yeah, then those who I'm awake and my glasses are working okay. Thank you. Where was I? 66, 67. Yes.
Well, first of all, you know, as the first report, I mean, it's amazing the amount that's been accomplished in with the backdrop's pretty big, finance report. So it is, you know, it's been highly commended. I just wonder if you're selling yourself short on page 67, point number 1. in relation, because we had a big discussion a moment ago about the interactive technologies, and I think the report said there was 99%. Again, we've got it down as 25%. Just wondered if you're actually selling yourself short on that percentage mark, maybe.
I think so. I agree with you.
Yeah, but
Yeah,
I suppose it's because the OT team are adult services, aren't they? And they're sort of leading things, whereas the adaptations team are the team who go in and potentially say, this might help you as well. So kind of adults are leading on it, we're kind of helping that, if you get what I mean. So maybe that's less a low percentage, but yeah, I get what you're saying.
yeah, I think it's a very good point, which is this. It's actually misleading, and it would be good if it could be. I don't know. We'll speak about it after whether there could be a recommendation to reform that story.
right.
Yeah, bonus.
Can I just add to that in terms of sort of aids and adaptations, I think in that has been about accessibility to people's homes as opposed to sort of smart technical pieces of equipment. But actually, yeah, we need to think about how we capture that, because in terms of Dave's team and what they're doing is phenomenal. So maybe we just need to change that for this year going forward.
It's just what we added. I mean, this is a very new approach within the adaptation team that's only been identified through the course of the last 12 months. So it's in its very, very early stages, but it's about helping that team to think differently and think wider about what kind of equipment and how they can support people rather than just the traditional America, the stairlift or the ramp. It's more than that. How can we get that technical support into people's houses to keep them at home much longer? But it's very early in the thinking.
And also, I think it just demonstrates the interrelationship we have with preventions, children and adults. And, you know, probably Caroline, Natalie and myself need to work smarter to make sure we're hitting the right things for our end of year reviews and our service plans. So because we're all interrelying from one another in terms of working. So yes.
Yeah, I think we recognise the closeness of the portfolios. And I would hope, and I guess you do. I would hope that you would collaborate very closely, and I believe you do anyway. And even on points like this, and I take your point, it is early days. We've only just begun, and it was a very helpful point raised by Councillor Bright, that it doesn't give a true reflection, and there are reasons why. And there are reasons why I guess it will be altered. You know, there you go. We'll leave that to you. On page 67, anything else on there? Page 68. Yes.
And the preventative services through sport and play are very, very important. But what are the issues that prevent expansion of this?
Of play.
Services, sport
And play.
I think certainly this big thing that come over to us from a different place in the authority, and I think certainly from a play perspective, there's been a very traditional way of delivering. We've been delivering, you know, certain kind of holiday club stuff and when it's holiday time. What we have done, one of the services that we have done a review of this year has been the play service, and that sits alongside the youth service, to look at and get a better sense of, okay, what are the issues, what are they delivering, and of what quality is it. And as a result of some of that work, we've already managed to widen the scope, so we are offering more play activities now than ever before. Again, there's been a workforce issue that sits behind it, so a lot of the workforce that we particularly go into the play doing seasonal staff, So, for example, it might be teaching assistants who work at schools, and then they might take up some extra work in the holiday time. So there's been a capacity issue, and there's also CIW regulations around staff ratio to children, and we've got to comply with all of those as well. So there's a number of things in there. But one of the things we have done with play is look to remodel how we can deliver it so that we can deliver more of it with the workforce that we've got now, whilst working towards a sustainable workforce going forward. So that's currently being worked on and is about to be presented to Councillor Harding for discussion soon. But there's a number of issues there, but we are absolutely aware that play is an area that we are absolutely wanting to grow and strengthen our position.
Thank you. Councillor Cleverly.
Thank you, Chair. My question is on page 68, item 4, on the youth service. I understand it's from the 1st of October 22 to the 31st of March 24, so we still have another year of this, and it's only 80%, so that's probably the reason why. But it also says at the bottom, on the right-hand side on the commentary, we have targeted 3 further youth clubs moving forward in 23-24. Can I ask if for an update on that and what areas they're in?
Gosh, there's an awful lot of work going on with the youth service. Again, partly because they've also gone under review and to look at how we can almost alter the delivery of the youth service, partly because traditionally where they've come from, they've been very geographical based. And one of the aims of prevention and inclusion is to make sure that we reach out across the city, not just in geographical areas or local. So there's been a lot of work reviewing, there's been a lot of work recruiting and making sure that we're getting the right staff who understand how to work with children in a youth model, and get them on board and get them experience. So we've been doing a lot of that. There's also been a lot of work joining up with other projects. So, for example, we get a particular grant through the Children and Communities Grant, which is known as PPEYP. That's about preventing offending. That's what that grant is targeted for. So that is being utilised to look at how youth service, youth justice, prevention, our partners in the third sector, Newport lives. It's looking at remodelling a number of areas. That's just one example where we're looking at how we can be innovative about how we develop the youth service going forward. So it's more than just having youth clubs across the city. We want it to be more than that. We want it to be linked in with lots of other sports activities that happen on a Friday night. We want there to be an outreach team, so there's visibility in evenings. We can, we're very ambitious, but as I say, it's quite early days, but there's an awful lot of planning and discussion going on. But the vision for youth services is in Newport is to really expand it and grow it.
Thank you, Caroline. I look forward to seeing this.
Councillor Amy.
Yes, my point, Chair, is on page 70, but it does concern the youth service.
Okay, should we?
So I was surprised. Yeah,
right,
shall we wait till we get? Shall we wait till we get to page 70?
Yeah, stay there. Any further on 68?
Yeah, I'm okay, yeah.
No, just hang on. 69? Anybody? And 70. Councillor Amy.
Yeah, thank you.
Thank you.
Yeah, develop a high quality citywide youth service provision. Can I just say that I know the action is ongoing, but I am not aware, for example, what's going on in my own ward with regard to the youth service. It says citywide. I am not aware what's going on in there at all. So, you know, it's a great sort of thing to aim for or to do, but can we have, you know, can we have an update on what is going on in the sort of citywide work?
Right. There's two points there. Number one, Councillor Army represents the ward of Stoke Hill.
Yeah.
I really think that it's really not to come here to ask what's going on in your own ward. However, if you don't know what's going on citywide, then I wonder if we could do a report or something for the committee, and then we pick all that up then together regarding what we do in the city or city. I mean, I don't know if we need to go citywide, the city centre to begin with, because other members will have maybe a greater understanding what's going on in their areas. If that's okay. Yes,
yeah, and Chair, you would have noticed I did not ask for my own ward. I did say for the city.
I know you did. I know. But I just making that point. Then there we go.
Yeah.
We can always take Councillor Arnold after this meeting and what's happening in his ward.
Yes, and that would be helpful as well, I guess.
Well, I think a note to the committee
and everybody.
Yeah.
Yes.
I mean, I think it's a really fair point.
It's a good point.
I apologise if that information isn't out there. It may not be out there because obviously the citywide vision is aspirational. We're not there yet. We're aiming to get across all of the cities. So at the moment, the vision is going to be located in certain areas of Newport, but we want to explore that. But absolutely, what we can do is provide a communication briefing of what is available where across the city, and make sure that that information is out there. One of the other actions in the plan, which may be further down, is developing a clear communication strategy so that everything that is available is in one place and everybody can access it. So we are on it.
Hallelujah, hallelujah, hallelujah.
So on new service, Chair.
Yes.
Can I ask what future developments you'd like to see in the youth service?
In the youth service. I think what I'd like to see is, and I don't know if Riaz, you might like to come in afterwards, but what I'd like to see is a move away from just the traditional youth clubs. They have their part, they play their part absolutely, and the ones that we do have are very well attended by children. But there are lots of children who cannot and do not want to go to youth clubs. So I think we have a responsibility to make sure that we're thinking innovatively about how do we engage with those children in community. How do we help to engage with children and build a relationship up with them in their communities so that we can help them to aspire to be the best person they can be. And that's not just about avoiding antisocial behaviour, it's about if they're having issues at school, making sure they've got somebody to talk to, helping them to keep focused and on track with education or training, whatever it is that they're interested in. It might be that, you know, they could be, they might excel at sport in some way, but actually they're not getting into where they need to get to. It's supporting children and young people in the right way, in a way that they wanted. So we shouldn't be expecting a children to come to this is the youth club and, you know, we should be out there in their community. That is my view and that is my vision. And that's what I'd like to see, but that relies on resources and money. So I have to be realistic with them.
But also with it relies on our relationship with partner agencies like Newport Live and those are the sort of relationships that we're building up to make sure that we are able to get as out there as we can to make partnerships.
Just for the, if I can.
Yeah, please.
We started a football club for the kids off the estate to come down to this William Pond to play football. And I couldn't get anyone to train the kids, so Carl Reid from Newport Live came over and volunteered this time to train the kids to get them started. And so they got somebody through their DBSs, etc. So they can continue with the training. So it's the left hand shaking the right hand, to be honest.
Yeah. It was, and I guess off the subject, you're working with local charities. I have to declare an interest because I've just mentioned that a sporting charity. I'm a trustee of it, which is the David Palmer Pierce Legacy charity that offer facilities and aid to people who, for whatever reason, cannot advance, be it financial, social, or other reasons. And so why I declared that interest, yeah, working with other agencies is my point as well, because it's all there to assist. But great work. Thank you. Yes, you can.
I mean, just on the back of all of those, for the last 2 years, it started with this just when I was working in that service, we started the football tournament in the summer holidays.
Yeah.
And so the first one we did was just phenomenal. It completely blew us away in terms of the numbers. Yeah. And that children and their parents, it's really a family focused event, and we did it again last year, and this year's event is on the 24th of August in the velodrome, down in the velodrome, the pictures at the back there. So if anybody would like to come along and see for yourself what is going on, and you will get a real view of just how engaged children are, and I will know the power of sport is a good way in with children, and we have a number of partners involved in a day like that. So we will have Newport Planner, we'll have the youth service, we'll have prevention, we'll have Newport Martin, we'll have positive future. No, it's some event, and it cannot bigger than we anticipated. So but it's something the children look forward to for the holiday.
And I guess for members who, for some reason, don't know about that date, can we send an email to members just to remind them? I'm sure they'd love to come and support. Yes, thank you. How's the family? Ladies, come on there.
Thank you, Chair. Right, my question is on page 70, number reference 2. Undertake children and young persons substance misuse needs assessments. It's only 17%, but we have got till March 24 next year on it. My question is, how do they monitor it, and what young people are they accessing and targeting? Is it young people in youth clubs? Is it young people in children's homes? It's just not very clear. So an update would be good.
Thank you, Councillor Beverley. This is a particular and very specific needs assessment relating to substance misuse services, and they're about to go out on a recommissioning for their specialist substance misuse services for children and young people. So thank you for bringing that to my attention. I mean, obviously at the time of at the time when this report was put together, it certainly wasn't 17%. So I think that's an error that's been overlooked. So I need to look into that. So thank you for bringing that to my attention.
Thank you, Caroline.
That's really now been completed. The assessment has been completed, and the system is currently being written and put together, ready for tender. And that one, the assessment involved children and young people themselves. It involved a number of workshops with various professionals and providers to really get a cross-sector view of what people felt was needed for specialist substance misuse services for children and young people. But thank you for bringing that to my attention.
That's okay. Thank you, Caroline, for the update. Thank you, Chair.
Thank you. Thank you. Page 71.
Thank you. Yeah, I mean, point number 6, when we talked about the support for families to reduce the carbon reduction of their homes, but adaptations are provided. And it's great that we've met, that's brilliant. And so I'm assuming there's been another action point coming forward to apply with the funding we've got. I've just Googled carbon home adaptations, not a lot came up. So what are we actually, what's actually going to those houses? What are the adaptations?
Yeah, so again, this has been very much part of early discussion with the adaptation team and the manager there in terms of looking at other initiatives. So whatever we're doing, going into people's homes, and also who we work with, what contractors we're contracting with, thinking about their commitment to carbon reduction in their own policies and procedures. So an example of that is the eco-direct initiative that they're just about to go live in. They haven't had any referrals yet, we're literally just getting the process together. So it's marked as complete because it's very much about, as an action, we want the team to be thinking differently about how we are supporting the carbon reduction corporate plan and how we then implement that into practice with our families who go and work with any of with the contractors. So we haven't got any data, but this time next year we will certainly have data on it because it's really been discussion up until now.
Yeah, thank you.
On page 71, number 7, it's underneath number 6 there. Merger prevention and resilient communities, that's marked complete. I see you've been merged since 22 November last year. How has this been received by families and by people accepting the, or is that still too early to ascertain?
If I take the bank, if you want to come in after us, I think it probably had a little impact on families. The driver behind merging those things together came out of the restructure and the establishment of prevention and inclusion. And what we had was we had two teams from a different part of the council overlapping, and there was an element of duplication going on. So it made sense to bring the two services together into the one team and have a very clear model and a very clear approach to how we work in terms of assessment and family plans and data recovery. So it's been more of an impact for the staff involved as opposed to family. The family was, if we've done our job properly, and I think we've done that piece of work really, really seamlessly and smoothly, actually families wouldn't really know much about it. It has more of an impact on the staff and involved a large staff consultation period to bring them over into the new service area. Overall, it's been received warmly and it's been welcomed by staff, and they're very, very settled now, and they have very clear lines of reporting, and there are not any issues that I'm aware of. Rhiannon, so I don't know if you want to add.
No, and it's been good in the sense of those of us that find there was community workers have come in with very good knowledge of their communities, which has supported the prevention workers in terms of knowledge and knowledge base about the different areas. So it's been really positive. Actually, when Newport, I thought, oh, that seems so long ago that happened. They just are part of the team now. So yeah, it's going really well.
Okay, so maybe we could have a further update, because it's really about how the families have access to wider resource, offer a range of evidence-based interventions. Those, I understand that, and because we have been kept up to date on this and about the new relationships that have been developed between two teams to remain as one, and fully understand the reason behind that. But it's how there's wider resource offering a range of evidence-based interventions to families. So that's where I'm coming from, is looking at how are they receiving it, what's going on in that direction. I'm not going to put you under pressure to answer that today, but to compare that in mind, and maybe you could just drop us something on it. Yeah.
Absolutely, that's not to the call, and the impact will be obviously we would have been able to see more families. Yeah. Okay, certainly that were coming through the single point of contact, this space far beyond channel. So we would have been able to pick up more families because we have more capacity. Yeah. That reporting is done to Welsh Government because it sits under family first. So we have all of that data.
Okay, that's lovely. Thank you. Okay. Okay, 72. 73. 74.
On 74, Chair. Can I ask for an expansion of the identifying the triggers project and the models of parenting groups?
Yes. So identifying the triggers, it's interesting to read that because it's a really kind of point of dealing well with problems. It's been a pilot project for probably last 3 years. Severely disrupted by COVID. So just before we were, just before lockdown happened, we were really starting to engage with schools and education to devise a model that responded directly to a report, a local report that was carried out, led by the OPCC. It's a report that focused on looking at the factors behind why children were becoming excluded from school. And then what we will do with this thing. So there was lots of very good debates at the time around should we have a non-exclusion policy, or do we just need to rethink how we manage children who are presenting challenging or disabilities, or how do we respond to them as organisations. So the report was done based on local children and local evidence. And we were able to identify some common some key factors, things like there may be substance misuse at home, parental substance misuse, there may be domestic violence, there may be a parent in prison, for example. There may be one of the children, maybe, they've got care experienced children. So there were clear factors that raised these children at higher risk of once they went to secondary school and their world go like that. Is actually then by years 7 and 8, year 8, we see a decline in attendance, and then we see evidence that they kind of go off people's radar and may end up in the British Achievement Centre, or they may not be in school or education anywhere. So who is actually seeing these children? And then you think about the risk of exploitation, criminality, etc., etc. So it's all wrapped up in that, and the model is very much about identifying the right children much earlier. So in years 5, 6, really that transition period, identify the children who have got these kind of contributing factors that place them at higher risk. And then the idea is to build a relationship up with these particular children and their families, support them intensely through transition into high school and through years 7 and 8. So it's very aspirational as a model, because what we're talking about is system change. So it's very much getting away from the idea that, well, we're going to just expel children or suspend children, and pause. Let's get a wrap around that child and the family and put a plan in place. We're at the stage where we piloted it roughly in Lamourin, and we've had great buy-in from the Lamourin High School. But there's been some changes with staffing, which has meant further disruption. But the long and the short of it is, we did see some very, very powerful outcomes for some children. Where, and an example I can give you is there was one child who was about to leave primary school to secondary school and wasn't engaging with hiding in bushes, would go in the classroom, was very, very challenging to engage with. And we put somebody to work alongside this particular boy and build that relationship up intensely, take them out, go for a walk in the park, take a football around, etc. We got the point where we got from where he was to where we then managed to successfully support him through transition, take him into high school in the summer holiday, because he's familiar with the school, etc. And actually support him into starting high school. And the last I heard on that case was that he was just doing extremely well. Now we know we had got involved. The head teacher of the primary school was already concerned about what was going to happen to him. So it's about how we work together differently. And the key thing about that is it wasn't about saying we need more money. we need more resources. It's about looking at what we've already got and how do we do things differently together that makes a better impact on the child. So we are now working to an evaluation report based on all the work we've done, so that we can then almost revisit it and relaunch it and roll it out across Newport if we can. That's the idea.
Yeah, just to comment on that, I think that's so important, getting, identifying problem children, children with issues early, and then supporting them.
Targeting the right children early.
Absolutely, and I'm sure that schools can primary schools, something can actually help in helping to identify possible children.
Absolutely. Certainly, while we've had the buy-in from teachers and it's been very successful, but trying to implement system change is a real challenge. You know, we need to think about how we can get the buy-in better and roll it out. And there's an aspect of being right, isn't there? Because it's about, let's not keep just doing what we keep doing. And the same outcome to these children happen if they turn up and, you know, they're particularly challenged that day, they end up getting suspended for a week without any thought of what's going on behind the life for that child. You know, we know these things are still happening. There's a lot of work still to do, but what we're trying to do is grow the evidence base from the ground so that people will have more confidence in the growth. That's the kind of forward.
I ask the second bit about parental groups support.
Well, the preventions team have just, so we did the recommissioning plans first, and the preventions team started providing parenting groups, a range of different parenting groups in conjunction with the early years, and always delivered parenting groups as well. And we've got a range of different groups, which I think are included in the report, so circle of security and non-violence resistance. So you can have parenting groups sort of aimed at teenagers, and also parenting group aimed at the kind of the early years and grown-up attachment. So we've got sort of a range that we need to live on.
Thank you.
Yeah, the whole point of understanding the triggers is looking down on it all to make sure, because if you keep excluding the child is going to end up criminalised, and that's all there is to it. Because he will be thrown out, or she will be thrown out of school. They then get groomed into making more criminality, and their life is over. Not one person in this room or elsewhere can tell you what that child has been through the previous night or the morning before school. If they come in, they're kicking off, there's a reason. Something happened to trigger them before they got to school. So rather than throw them out, what we should be doing is put an arm around them and say, you're in a safe space, so what's going on? Which is what understanding the triggers, the ultimate part of it.
There also has to be a balance between the safety of the other children.
Absolutely.
And the needs of
getting
the
that balance.
individual.
I think that balance is achievable because you're working with education. You're working with your justice service, and a lot of other agencies are involved in making this decision. At the end of the day, if anybody has to be, let's say, taken out, it's not because people haven't tried.
No.
It's there. It's you know. But the last thing you want is a child excluded. The very last thing, and I think the cabinet member is absolutely spot on. You don't know the journey that person has been on, and that there lies the issue. And I know that all concerned, have the best interest and the best outcome for that child.
It's as Caroline said, catching them early, trying to identify what was triggering things, and the earlier that you can intervene, the better.
If I can just add to that, sorry, a point I omitted was when we did the research, we looked at years 5 and 6 of these children, and their attendance would be in the 90s at school. And then when they went to high school, 7 and 8, their attendance dropped massively. So that's why it's important. That's when they're in school and they're engaged and build that relationship to hold them through that really difficult transition. It's scary for children, but they need to know that it's role models, the adults, that they're to support them.
As I haven't never said, you do not know. I mean, between the younger age and the transition age in school, you don't know the journey that's gone on, which is might not be the same as when you see them younger. So it's we don't know the journey, and we're doing as best we can. And then mentioning yes.
Yeah, and also years ago, you also worked well with Great Police in terms of, so if they had been called out to a domestic violence incident the night before, we've got a system in place now in the previous role, so that by sort of 8 o'clock in the morning, the school would know something had happened. So if a child turns up about their homework or looks a bit disheveled or whatever, they know something's happening. They don't know the details of it. They just know to be a little bit kinder, a little bit more sort of child friendly, and just be a bit kinder in terms of just trying to manage that. So behind the scenes, we would be doing whatever. It's just about having that communication with children, about children, with sort of those first people they're going to meet in terms of schools. So I think that's still ongoing now. That's a big investment from Children's Services and the police and the working together. That's about just trying to, is that the identification, isn't it? You know?
Yeah, and there we are. Okay, we're going to move on. Thank you all for your contributions. We were now 74 and 75. 76, 77.
Chairman,
Yes, Councillor, you want me?
thank you.
There's a voice from above.
Yeah,
You won't be out there.
I know this is a very challenging area. There's no doubt about it. We are talking now about Welsh medium, Flying Start in what sort of Welsh medium. As you could see, well, it's a new measure, a new performance measure, but doesn't have much data in it, but a very useful commentary. So a couple of questions on that. So are we looking at the Welsh medium schools, you know, both primary and secondary, in terms of sort of the development of this area? And in 6 months' time, because the indication is that this table is updated half yearly, are we likely to see more useful data, you know, in this particular area?
Thank you for the question with 2 points. On the first point, I will say that it's probably right for me to say that the development of future schools, Welsh medium schools, is outside of my remit. That would be a question that needs to be picked up with the education.
Yeah.
So I'm sorry, I can't progress on that one. The point about more useful data is, you're absolutely right. We will be getting it. The reason why this is a particular challenge for us and the target is set so low is this is very much an aspirational performance measure for us. So whilst the Welsh Government and Welsh have got their targets to improve and enhance Welsh medium provision, and Flying Start, the expansion of Flying Start, which is all about expanding the Welsh medium provision for Flying Start, the early years for children before they go to primary school. the fact of the matter is that we do not have that provision in place just yet. So it's very much our plan in action. We will grow and develop increasing wide medium provision going forward, so that we are then better able and better placed to offer those wide medium places for people who are requesting it. So it is very aspirational. We certainly will have data going forward on this as we grow our resources and our provision. And I certainly expect that to improve because it's a core principle of our expansion programme.
Yeah, I mean, you know, like I said, really, you make a comment right at the end about recruitment of practitioners is very challenging. I don't doubt that at all. The sort of the report on the annual report was presented at council last week. You know, and I've raised that issue there as well in terms of, you know, the aspiration to have sort of 1 million speakers by 2050. It is a very tall order, but you know, a lot of the work needs to come really from the area, trying to develop you know, develop sort of increased Welsh speaking and Welsh involvement, Welsh language involvement. So yeah, I mean, I can appreciate the issues, but you've accepted it as a new measure. So that was the reason for my question, really. It doesn't look very good now, just looking at it, no data. And hopefully that in 6 months' time, we will have some data, and that was why I asked the question. So are we able to do that, do you think?
Well, I mean, it is the reason you don't have data that gets prior, because it wasn't there. And so it wasn't picked up before. It is picked up now. And I think the officer's given a good answer. And it's a developing area. As we know, we all know it's a developing area. And it's good to see it here, because we will be able to, under the prevention and inclusion performance measures, be able to look at this as well. And it is a bit of a crossover with education. I get that, yes.
Yeah, and an example of that is just in the last 12 months, we've managed to successfully engage and tender with 2 private Welsh speaking providers, childcare providers. Yeah. So it's about building those links and building those relationships, and that all takes time, unfortunately. Well, but you will see that grow.
And it's a great question, Councillor Amy, and I do accept that we will see it grow, and we'll watch out for this one. We just keep on watching out. So thank you for your question. Okay, any further comments on 77? 78?
On 78, I just have a little bit of an explanation, please, about quality of life for substance users. It's actually on 78 and 79. Yeah. Quality of substance use is improved and changed between start and most recent review. And then the commentary uses a key performance indicator, and then you've got a treatment outcomes profile, and then on the following page, and the last sentence says, Newport reports a higher level of QOI. That's some of the areas of went. Quality of life. Quality of life. That's what I was.
Measuring substance issues and the impact treatment that we have on life is a very, very complicated subject, and one that I think is very wonderful to get our heads around. It took us a long time to get to a point where we felt happy with that sort of comment through. That said, I feel it needs to be broken down more. I think it's far too complicated, but it is a very, very convoluted system, the way that appointment outcome profiles are basically assessments. There review assessments that are done with a service user who can then report on the thing that's changed in their life with the result of having intervention. But it doesn't just look at one area, they could be looking at a whole different thing. So all of those things come together under quality of life. It's very, very complicated. So I apologise that it's not clearer, but it's certainly something that we're working on ourselves to bring some simplicity and clarity to it. The issue about the we report at a higher level, that is to do with the reporting system in itself. So it seems that Newport report what they do their monitoring return. They do it absolutely accurately, you know, that the figures are the figures and we report on them. It seems that that's not always the case across the local authorities. It feels like there's some discrepancy, shall we say, about how reporting is done. But I'm categorically informed that the way Newport does it is accurate, it's reflective, and I think that's the right way. So that puts it in a bad picture, a good picture. We can't argue with the fact and figures really. But I will take your point, and I certainly will be working on that going forward in the commentary for you.
I think page 79, page 80, page 81, page 82, unlucky to report. Somewhere in your report, somewhere, you've done some excellent work on I think the correct word now. I'm going to get there in a second on succession planning, where you're training workforce. You've got them and they're stepping up, and you're putting behind, and hopefully they're going to continue with you. You're beginning to look at how you can upskill and support your current members of staff who one day will step up and step over and step in. And looking at that, I think out of everything you've done, if I had to pick something up in the report, that's good for the future. That's good for the future. And I'm sorry I didn't mention it earlier, and it is in there. God knows where it is now. Yes, maybe, yes, there we go. So thank you. Can I thank all the cabinet members for their attendance and interaction this morning, and all the officers for your interactions and explanations as well. On behalf of the committee, I think we'll have a slight recess for 2 minutes, let the room clear, and then we'll continue.
Thank you. Yeah, thank you.
Thank you, everyone.
No, we're not.
There we go, we're live again, Chair. There we go.
Okay, welcome back. Now the room is clear, and we will continue on with Sam. Do you want to take us through the committee conclusions?
Absolutely, yeah, Chair. So there weren't so many comments and recommendations as there were actions for more information. So just to make sure I've got them all down properly, we've asked for an update in writing on the rapid response team, an update on specialist placements, an update on child exploitation numbers, which Sally said she could provide for us. Mary offered to do a set-up session for all members on the technology available. The what did you call it, like the
technology?
Yeah, the animatronics they use and things like that could be brought in for us to have a look at.
Sorry, on the back of that, could we have a site visit?
I can say yes. Yeah.
Yeah.
To which site specifically?
I think it's the
Market.
Yeah. Absolutely. Then there was an update for the whole council on the dolls LPS schemes.
Yeah.
Which have been paused, I think was the word Mary used, or put on.
It's the continuation of dolls.
Yeah.
And to explain to members what deprivation of liberty is.
And
so they get an understanding that they're working still in that framework and not the new one that was going to be introduced.
I think the final further information we asked for was the data on the impact of families from the merging of the teams, the prevention and resilient communities teams.
It was youth provision, or haven't you got to that yet?
Haven't got it yet.
Right, okay.
That's fine, don't worry. The youth provision,
Per ward.
Yes, building up from the city outwards.
Yeah.
Yes. So further information was available, absolutely. Let me write that down. But so further information.
Youth provision in wards.
Ward by ward. There we go. And that's pretty much all the further information we've asked for. I think there are a few other points, Chair, you wanted to discuss in this section, just so we were clear on what we were asking. The first one I have on my list, differences that Councillor Elrainey raised about the objectives 1 and 2. And that was on page, if I can direct members to, I think it was the first page of the Prevention and Inclusion Report, which would be 61. Objective 1, if I can just say, Objective 1 talks about the way they want to deliver these services, so in their own communities, whereas Objective 2 talks about the what, so the range, if that makes sense. That was my take on it, but if you wanted it to be reworded, maybe or clarified, certainly make that recommendation.
It's a recommendation that you would make. I'm not quite sure where you would send that. I wouldn't send that to cabinet, but I mean,
maybe it's an understanding.
I'm quite happy with the explanation.
Yeah.
That there are two similarly worded but different objectives.
I tend to agree. Does anybody else have any views on that point?
No, Chair, but I have a point to raise, if that's okay.
Okay, just a second.
Okay.
We'll deal with this one first. Councillor Elrainey?
I don't think he's with us anymore, Chair.
He's disappeared.
Yeah.
Okay. I believe it's the view of the committee that's just saying, unless anyone has any contrary reviews or views. Okay, the committee wants that just resolved. That's resolved.
Nice. Another one is Councillor Bright, your point about recommending that they relook at the data regarding interactive technology in the prevention report.
Yeah, that's yeah, it's like I've said, positive behind.
Yeah, so just happy with this recommendation.
And then taking a look at that anyway, so there's
It's always a good reminder, isn't it?
it's a good reminder, yeah.
So a recommendation to relook at the data and be more, to be fairer,
Positive.
More collaborative with it. I
to
just
highlight the collaboration.
yeah, of the data that's been collected together, not it's this separation out,
Yeah.
which is making them look a bit weak. When that's right, they're not weak. It's
So a recommendation for the prevention team to relook at the data regarding that,
yeah.
highlight the collaborations that they have
Yes.
to ensure a fairer picture is presented.
Yeah.
That's it.
Yes, that's right.
There we go. And then, and that's a duplicate anyway. Okay, more information about the use service. So it was there. I think that's it then, Chair, from me.
Councillor Cleverly.
Thank you,
Oh,
Chair.
Jan, sorry,
My,
yeah.
my suggestion is, before, we used to have councillor visits to the adult and children's homes. Do you think we could pick that up again? Because it was very enlightening. Trevor might remember that we used to visit the homes.
We used to visit them, I know we did, but don't forget, these are
Children.
these are their places, these are their homes.
Exactly.
This is where they live. I'm not quite sure whether that practice, there used to be a social services practice where a group of members used to go around to try and ensure that everybody was safe and secure. I'm not quite sure whether that worked.
I know it was before we went into lockdown. And we went in pairs as well.
Yeah, that was in operation. I guess it's something you could. I don't feel myself, I'm in your hands now. I don't feel fully committed to it myself, so I'm gonna push for it. But if the committee wants it or wants to ask that, then fine. You can ask whatever you like. But I don't feel fully committed to that direction myself.
Okay, I just thought I'd mention it because I thought it might be good to reactivate it.
You can certainly raise it elsewhere as an individual, though.
No, that's fine, Chair. That's fine.
Yeah.
Thank you.
Thank you. With that, then we get the Walk Forward programme. Back to you, Sandra. Thank you.
That's me. I'm sorry.
I'm so glad.
Yeah, that's me. So the action plan, the action sheet, I should say, totally empty, but I'm sure we'll have a few in it from today. And the forward work programme, nothing's changed as it stands, still as it is. If there are any things added to the forward work programme as a result of today, I know the action Sally raised, she was keen to bring to committee.
Yes.
The child exploitation item.
Yeah.
Would members prefer that to be first and foremost an information report and then decide if they'd like to discuss it further? Would you like?
I think that's a good idea. I think an information, I mean, up to you guys. I think an information report is always helpful. It's always helpful. But you know, throughout the year, if we want to have an extra meeting tactic to pick up stuff that we believe is going to take longer to give it justice later on. You know.
There were two items that we were offered presentation on. One was the exploitation report. One was, remind me.
There's a few. So from what I've got, the rapid response team was a written response.
Yeah.
They were specialist placements.
Yeah.
There was a session for the technology from the adaptations team.
Yeah, and we're going to go
And that
down
would
and see
be,
that.
yeah.
Yeah.
The child exploitation was offered either as a session or an information report. The dolls was written separately.
Yeah.
Further information on youth provision would be written, I presume.
Yeah.
The impact on families would be data that was provided to committees. We resolved the objectives issue. We've made a recommendation about the collaborations. flick through my notes, see if I can pick it up. That's the only one I would like to note in as a session, but as a committee meeting, if you will, as an item.
Right.
Well, if you think about it, Pat,
You can
you
absolutely.
can always just
Yeah.
email
Put me
me.
an
just,
email and
uh,
you could have like that if that's
Yeah.
easier. But that's the only one I had noted as a committee meeting.
Right, okay.
Okay then, right, we're gonna move on now then. There isn't anything else on the forward programme. If you find what you want,
Yeah,
speak with Sam.
absolutely.
That's not an issue. And if there isn't any other business before us in any other shape or form, I thank you all for coming and thank you all for your participation this morning and the team in the background that you don't see. And thank you all for watching at home. So goodbye. Thank you.
Thank you, Shane.
Okay, well.
Bye all.